Survivorship issues on patients who are receiving immunotherapy are completely different than those who are receiving traditional chemotherapy. And when I say that, you really have this phase where they're being actively treated, and so we're seeing side effects that we may not see, such as a skin rash. And that poses a completely different challenge to patients because you want to say, that might be a good thing, it might be a bad thing, but how do you seek treatment in the most appropriate way and in a time frame that might be most effective to them. Then you think about these long-term survivors, and the blessing of immunotherapy is that we do have patients who are on the end of the curve, so they may be alive years longer than a traditional patient would have been before we had immunotherapy, and we really don't know what those long-term effects will be. So we're sort of crossing this bridge as we're walking across it. The thing that I always like to say to our patients, though, is make sure that you have a conversation with your healthcare team, because you may be experiencing something that is incredibly important for you to have intervention early. And because you're on an immunotherapy, that sort of raises the stakes a little bit for you. So make sure that you have that open conversation with your healthcare team. We're talking to patients who are getting treated today. So traditionally when we talked about survivorship care planning, we thought about after they've received their first round of treatment, and now what do you watch for 5 years, 10 years, 15 years later. With immunotherapy, you have to start that care plan in the present moment in time, because there are so many specificities that patients and their caregivers have to really think about. If you have to go to the emergency room, make sure that you tell your provider that you're on an immunotherapy agent, because the protocol will be completely different, as one example. So it really is thinking about that survivorship care plan in a much earlier setting than you normally would have thought about it, and make sure that you really include all of those things that the patients may not be thinking about, which includes simply how to communicate with a healthcare professional, which is something we really didn't think about before.
Survivorship, I think, is a unique concept when we think about immunotherapy, because it's a new modality of treatment and not something that we've equated in the past with survivorship. However, now we are seeing long-term survivors of patients with advanced disease who are on these agents. And we're starting to shift these agents into earlier stages of disease, so survivorship does become a concern. Survivorship care plans often are templated in many practices, and so the templates need to be created to accommodate these new agents. We usually provide patients with a summary of their treatment, and so we need to be able to pull in these newer agents in that summary. So that's one way where we have to modify survivorship care plans to take care of these unique patients. The other is really in accommodating the side effects that are unique to the IO therapies. So we need to really address a lot of those immuno-related side effects that typically may not be part of our discussion with cancer survivors. So care plans need to incorporate things such as the itises. We don't know what long-term effects these may have, but I think it's important for patients to recognize that there can be immunotoxicities associated with these drugs, and to have those listed in the patient's care plan.